Alright, here we're going to start with chapter 34. Hopefully it'll just be one section of audio notes about looking at the male reproductive system and alterations that you can find there. First disease issue that we're going to look at is urethritis. Alright, this is an inflammatory process usually caused by sexually transmitted microorganisms, inflammation of the urethra, but it doesn't have to be transmitted or a sexually transmitted disease or an infection. There are also non-sexual origins that can cause issues, such as urological procedures, insertion of foreign objects, and hopefully we're talking about a catheter there. There could be anatomical abnormalities that cause inflammation, and then of course trauma. Symptoms of urethritis include urethral tingling, some itching or burning sensation upon urination. You can also have issues with frequency, urgency, and even sometimes purulent or even clear mucus-like discharge from the urethra. And generally treatment is going to be antibiotics for the infectious cause of urethritis, or simply avoiding the irritation. Right, urethra strictures are fibrotic narrowing of the urethra, usually caused by scarring. The scars may be congenital, but generally a result of trauma or untreated urethral infections. Orchitis is an acute inflammation of the testes, and sometimes also involves the epididymis. Mumps is the most common cause of infection, and so this is going to be viral in nature. There is a nice vaccine that is available to keep a person from getting the mumps. But if you come down with it, it's generally not that big of a deal. It infects the salivary glands typically. The person can feel ill, or just not feeling very well. They can have fever, pain with the inflammation of those glands. But in about 30% of cases with men, the virus makes its way to the testes and can infect the testes. And here you have the signs and symptoms for the orchitis. Alright, and the scrotal tenderness seen here, alright, that tenderness can actually be just flat out pain, and very severe pain, and can cause sterility if it occurs bilaterally. So complications of getting mumps, alright, not that big of a deal, I guess, if you're female, because then there really aren't any complications. But if you are male, you got a 1 in 3 chance of not being able to be a father of your own doing later on in life. Alright, then epididymitis, inflammation of the epididymis, common in sexually active young men. In older men, say older than 35 years old, intestinal bacteria and Pseudomonas are most often the causative agent. And so what happens is the pathogenic organism reaches the epididymis by ascending the vas deferens from usually an infected bladder or urethra. Alright, BPH. You see a lot of commercials about this, benign prostatic hyperplasia. So this, you have an enlargement of the prostate gland. Alright. Problems are that it compresses the prostatic urethra, and so then you have issues with urination generally. So symptoms include urge to urinate frequently. Sometimes there is a delay in starting urination. The person can have incomplete emptying. Feel like they always have to go, even though they've already gone. Alright, and so there is a strong relationship to aging. As a man ages, there's more likely the chance of developing BPH. And evaluation, the biggest one, the easiest one is going to be prostate-specific antigen, looking at the PSA monitoring. Right? As the prostate enlarges, you have more prostate-specific antigen being pushed out into the blood. And so it's pretty easy to test for that in the blood and then the urine. All right, treatment, really just aiming to try to treat or to shrink the prostate. Prostatitis is an inflammation of the prostate, usually limited to just a few of the gland's excretory ducts. All right, it can be classified as acute bacterial prostatitis. Generally, it's going to be an ascending infection of the urinary tract. So, what happens is infection stimulates an inflammatory response, and that inflammatory response causes the prostate to become enlarged, tender, firm, and have physical manifestations such as urinary tract infection or pyelonephritis. And because most often this is going to be caused by a bacterial infection, treatment is with antibiotics. All right, cancer of the prostate. This is a big thing. It's the second most common cancer in men, and usually there's good prognosis for this cancer, but it's often asymptomatic until it's advanced, and you do want to treat it. There's some sources that say the prognosis is good even without treatment, but again, it is cancer, and so you want to do what's best for yourself. So the manifestations of disease are slow urinary stream, hesitancy, incomplete emptying, frequency, nocturia, dysuria. So it can be very similar to BPH, but unlike BPH, the symptoms of obstruction caused by the prostatic cancer are generally progressive because that tumor is not going to regress like inflammation might. So symptoms, possible risk factors, dietary factors, hormones, vasectomy to cause that inflammatory response to begin, and then chronic inflammation. More than 90%, 95% are adenocarcinomas, meaning they have that hormonal component. Symptoms of late disease include metastases. All right, so again, the fact that treatment can be possibly good without treatment, or prognosis good without treatment, you really want to treat this as best you can and as quickly as you can. All right, because prostate cancer can metastasize. So just looking at some possible causes of inflammation in general to the prostate, we have infections here, bacteria, viruses, hormonal changes, physical trauma. All right, so this could be an issue potentially for athletes, and urine reflex, issues with urine moving back through the urinary system. Dietary intake of carcinogens. You've got this nice picture of charred meat, even though it's often kind of the best part of barbecue, is that little bitty edge that's been barbecued too much, or meat that's baked in the oven. You get that nice crisp piece of skin or part of the meat that just is really chewy, kind of like jerky. Alright, tastes good, but it may not be the best for you. So all of those can be issues for inflammation. That inflammation can cause BPH, but continued and chronic inflammation can also lead to those prostate cells becoming cancerous, developing multiple mutations. Alright, so here are a couple of figures from your textbook. Possibly. I think they're still there. For sure they were in a previous edition. And here's the rate of prostate cancer per 100,000 men. In North America, woohoo, we lead the world by a lot. 120 cases per 100,000. Alright, it's not a huge amount, but it's it's quite a few. But you look at it at the fact that it's almost twice the number third person or country area, Western Europe and Australia, New Zealand, 50% higher than those rates. Alright, people down here, Northern Africa, well, really just looking at a large portion of Africa and Asia. Alright, they're doing something very different than we are. Alright, looking at how little prostate cancer they have versus our numbers. Something to look into. Alright, then metastasis. Locations for prostatic cancer, metastasis. Lung, 45.7%. So lung is going to be the number one location where you would see metastasis from prostate cancer. But there's a lot of other areas where it might happen to go through. So, long-term complications complications of having prostate cancer, it can move anywhere. There can be issues with it going to the brain and then causing neurological damages. Bone, also a big place. 90% possibility of it showing up in a bone. So you really want to treat it as best you can and as quickly as you can to avoid the movement of those cancer cells to different areas in the body. Alright, then real fast looking at disorders of the male breast. Alright, one issue is gynecomastia, and this is simply the overdevelopment of breast tissue in men. Alright, we see this actually quite a bit. About 35% of the male population has this issue. And generally it's going to be a result of hormone alterations. Can have an unknown reason, can have systemic disorders, could be issues with drugs, could be cancer issues, but typically you're going to see this in adolescents and then men who are older than 50. But usually it is an imbalance of the estrogen and the testosterone ratio. Alright, generally fix that and you can alleviate the breast tissue. Alright, then male breast cancer doesn't occur very often, but men have breasts, so they can also develop breast cancer. But not nearly as much as females, again because of that hormone component or hormonal component. And with males, it's typically seen after age 60. Tumors resemble the carcinomas of the breast in women, and some of the physical manifestations, the crusty and the nipple discharge, very common clinical manifestations in men, just like with women. And that concludes chapter 34 material.